All right, so I am going to be recording our session today. And it's really, really nice to have everybody on today. Welcome to our webinar. Good to see you, Marian and Pedagay. Mom Nestor, we see you. Ruth, you're always here. Nice to see you. And Esther, Ephraim. Thank you all for joining us today. Hopefully everybody is having a wonderful Saturday. We'll just give a minute or two to see if other people, to give people a moment to join us, and then we will get started. Okay. All right, I'm going to just ask that everybody stays on mute when you're not speaking, just so that we don't have too much feedback or interruption as we chat. We're always excited to have a moment once a month to just talk about mental health and how we can support the community and how we can help each other and make sure we're all in good health. And to also welcome questions from you all. Today, we're going to have a really exciting conversation, which is really one of the reasons why we have these conversations. We're actually in our second year of our webinars, which is absolutely exciting. I was just looking back, and we started our webinars a month after the pandemic kind of arrived on the shores of the US. And it's really been a joy to serve all of you and to have conversations and to provide information for the community so that we can learn about mental health and how to take some tools that would help us personally, individually, and also our families, our friends, our communities, because the stresses around us are a lot. And as much as we may ignore the impact of those stresses on our mental health, it does affect us. It does touch us, whether we acknowledge it or not. The impact still remains. I know that for most of us, we perceive mental health seeking behavior as a Western way of dealing with stress. And in most collectivist cultures, whether it's African culture, Middle Eastern, Latinx culture, you know, we tend to, and even Asian cultures, we tend to say that, you know, this stays at home, that what happens within our family stays at home. We don't talk to anybody about it. And I'm sure most of you can say your mother, your grandmother, somebody told you, hey, we keep our business in the family. Don't talk to anybody about what's going on in the home, especially if it meant that you're going to talk about the impact of those relationships. On you. It would mean like, hey, are you saying that your parents are bad parents? Your mom is not a good mom? But the impact remains, whether it's how you were raised, how the kind of disciplinary styles they used, or whether it was the level of attention or the lack thereof that you got, that may impact how you operate. But more and more, we can see that people are acknowledging the impact. And I know my fellow panelists will be able to think about your childhood, that there was somebody either in your family, in your community, somebody around you that we all thought was rather strange, because maybe they would have manic episodes or they'll have psychotic episodes, and everybody just called them the crazy guy, or, you know, or it was a family member. And as a child, I know I didn't even know what was wrong with these people. But now that, you know, I've had an opportunity to learn how to deal with all of these issues, I recognize that, wow, that cousin was actually bipolar and something was going on there. They were going through a manic episode, but nothing was really done with them, especially if they were not, quote unquote, crazy enough to be taken to, say, Madari Hospital, a psychiatric facility. They just remained in the community and we didn't know what to do with them. But now we have been talking about help-seeking behavior, destigmatizing, you know, mental health, and how we can just acknowledge and address those issues. I've seen more people reach out to us and ask for support and ask for direction. How do I seek help for myself, for my child, for my spouse? And so today we wanted to take some time to just talk about So now that you've said, yes, I recognize that this is a mental health issue and I want to get some help. And then you all ask us, so what happens when I make that phone call, I schedule that appointment and I show up? Because I think most of us here know what happens when you go to your medical doctor. You know, you show up there, you know what happens. You know, they take your vitals, you get on the scale, they check your blood pressure, they do blood work, they tell you to open your mouth, they look, they check your breathing. We kind of know what happens. And then the doctor asks you all these very obvious questions. So there's a little bit of, we can anticipate what happens when we are visiting a medical professional. We actually know what will happen when we get there. We know the questions they'll ask us. We anticipate how we're going to answer those questions. But therapy is a different thing. I'm not going to ask who here has been to therapy, and some of us may be able to share if you want to, but we schedule that appointment and then we're like, so what will happen when I get there? What are they going to ask me? What am I going to say? How long do I have to stay there? How long is the appointment? Do I have to come every week? What do I tell them? What should I not tell them? All those different pieces. So today we're just gonna have a conversation about that. And I have two amazing, amazing women, good friends of mine, mental health professionals who are going to help us have that conversation. And so today is really informal, by the way, guys. We're just gonna chat. So I'm going to allow them to just take time, introduce themselves, talk about their background in doing this work. So I'm gonna invite Brenda to go first, and you can probably tell us a little bit about yourself and the work you do.
Hi, I'm Brenda Ngure. I'm not new to this platform. I'm always looking forward to come here every month, even when I sit at the background, which I might prefer. I am a social and behavioral consultant. I do my work mostly on the intersections of mental health and sexuality. That is my passion. I've worked in the mental health and social service field for God knows for how long, over 15 years. I do mostly psychoeducational services. Currently, I'm in crisis intervention, and that's me in a nutshell. Thank you.
I'm going to invite Julia. Go ahead.
Hi, everybody. Happy Saturday. I am a licensed mental health counselor and a licensed marriage and family therapist here in Florida, which is the southern part of the US. And I've been doing therapy since 2007. And my specialty is really, or rather my love and passion has been helping couples especially be able to navigate relationships and marriage right from engagement, dating engagement, all through to at least the first 7 to 10 years of their marriages. I also do individual therapy, which means a lot of my work is helping people cope, get over, or learn how to live with either depression, stress, anxiety, and also branching into work with women, especially women recovering also from relationship issues. And then I've been doing private, meaning private practice with partnerships with nonprofits, or what we would call in Africa, non-governmental organizations, NGOs, helping to expand access to therapy, especially for our African diaspora and our Black community, African American, Caribbean communities here in South Florida. So that has been a passion of mine. And these webinars that have been a year old now, that has been part of the passion that we've had with Lillian since the beginning, in being able to provide a forum for us as Africans around the world. Honestly, the Lord has put us everywhere to be able to talk about mental health and help each other be able to deal, especially now with COVID. So I'm really excited about today, because you'll be able to just have that conversation and have, it's informal, as Dr. Odera mentioned. It's going to be really informal, just asking questions back and forth with us guys. And the blessing is we have a couple of therapists and providers that are on the chat right now, and they're based either in Nairobi or other parts of the world that we're able to talk with together. So I'm excited about that. Thanks, Dr. Liv.
Awesome. Thank you, Julia, and thank you, Brenda, for being here. So like I said, this is going to be really informal. I want to encourage you to ask questions. So please just put your questions in the chat box. Some of you have forwarded questions to me at one time or another, but just you're welcome to put them in the chat box. You can either just put it, everyone can see it, or if you want to just make it a little private, you can send that question directly to me through the chat box, and then we can be able to address those questions. Please, this will be very helpful if people can ask questions. And we are also live on Facebook, so if you want to go to my page, those who have access to my page, and share the link to other places that you want people to be able to join us, we're live streaming, so they can watch us on Facebook, or also I'm recording this and I'll make this available on my YouTube channel after the recording for people who may not be on social media as well. But please feel free to just throw your questions in there. We have some starter questions to go with. And so my first question is, and Julia, since you primarily do therapy, you can answer this. At what point, and Brenda as well, because I think you have an interesting perspective to this, at what point do you recognize that what I'm experiencing is beyond what I can just deal with my own coping strategies? Like when is that time when I need to actually seek professional help? How do I know that, you know what, this is different with just my regular, this is not just a bad day, that I need to get help?
Okay, thanks for that. That's a really good question, because sometimes when we're feeling sad or down, we might not be able to tell what's the difference between just being sad or experiencing actual depression, mild depression, for example. So I would say the length of the symptoms, the length of what you're going through is a good indication. And usually if you're going through it sustained for 2 weeks at least minimum, not really minimum, but if it's at least 2 weeks and no matter what you do, you're not finding any symptom relief. And usually you'll notice, even with anxiety, stress, depression, some symptoms are similar among the three, because it might be loss of appetite, because your body is just not functioning. And again, that's why when you see your doctor, they always ask you about your stress level as well. When you see your doctor with somatic symptoms, meaning physical symptoms. Also, if sleep pattern, if you've noticed your sleep is not alleviating at all, like you're having big issues sleeping within that period, your mood is not changing no matter what you do. And this is the big tell. If things that bring you pleasure do not bring you pleasure at all. I mean, maybe you enjoyed watching the kids play, run around, you enjoy going to the park, you enjoy cooking, you enjoy fixing your car, you enjoy being with people in a party or just getting together with friends and family, and none of that is making you feel better. Those are some of the signs that begin to have like an alarm clock in your mind saying you need to talk to somebody. And you know, the thing is, we also have to take away the stigma of feeling as if we have to suffer for a long time before we seek help. And I know that's how we tend to do with medication. We tend to be like, oh, we'll power through this headache until we can deal with it anymore, then we go get meds or talk to the doctor. But there's no reason to completely put ourselves through the pain. It's okay to talk to somebody before that and start figuring out if you're heading into a deeper depression, because our goal is to get people help before it becomes so chronic that it takes a longer time to recover from it.
Thank you for mentioning that. You know, the idea of we have this ridiculous threshold for pain, whether it's emotional pain or physical pain, sometimes the impact of that can be really bad, because you're saying, you know, we're told be strong, just tough it up, especially if we start talking about gendered experiences. As much as we say, okay, you know, we are women, we should just be able to tough it out, you multitask. But there's some things that you can really ignore, and they're getting to a point where it's really corroding even your basic capacity to deal. So just be mindful of that. I would definitely say keep an eye out for, has your sleep changed, you know? And it's no longer, you know, sometimes there's almost like we have this superwoman syndrome of I survive. It's almost like we're exchanging notes. How long can I go without sleep? Or how long can I go without food? And that's detrimental to your health. Brenda, you want to say something about when do we seek help?
I think the question is, why not? I feel like we have this idea we got to seek mental health support because we have a problem. I feel we need to make it like a norm. The reason I go to my medical doctor just for a physical, sometimes it's because something has happened. Sometimes it's just to check me up. I just had my dental exam this month. I had booked it 6 months before, and all the doctor was doing was just a regular checkup. There was nothing wrong, but as we were doing the dental exam, they found a problem. So I feel like we need to make it like a norm where you just go sit down. I know most of us here are privileged to have vehicles. And how many of you have an auto technician? You just have, it's not that you take a car every day. You just have an auto technician because he understands the car. Sometimes you might have the basic understanding of how a car runs. And when you take it to him, he has the tools. It's the same thing. If I access going to a therapist, going to a psychologist or a mental health professional, it's just to maintain my mental health. That is I like being preventative. The other thing I know for myself is life adjustments. And when we talk about life adjustments, we are not only talking about the tough things like grief, divorce. It might be things like a marriage. It might be things like getting a child. It might be something like getting a new job. It might be something like moving to a different city. Most of us who left Kenya and moved here, it was a good thing to come to North America or wherever you are in the diaspora, but it came with its own challenges. But if you make mental health support a regular thing, you are able to consult with your mental health professional about adjusting to those life adjustments. I know for me, one of the toughest things that I have realized with my own mental health is I struggle a lot. I don't like changes. Guess what? Anything that is out of the norm just triggers my stress level. So that's my take, Dr. Lynn.
I like that. Adjustment is a big one. I deal with college students, and as you know, right now, there's a huge transition at every level of education. Some of you are taking your kids to first grade for the first time. They're going to elementary school, middle school, some are starting high school, some are starting college for the first time. That's a huge life change for you. Even if they're just starting pre-K, that's a big one as well, because that's a life transition for your entire family, for you, for your child. I'm in a college system. So right now I'm dealing with kids coming to campus for the first time. And most of the kids I work with come from out of state. They come from California, New York, Texas, somewhere else. And I am anticipating major adjustment issues. And it doesn't mean that something is wrong, like Brenda mentioned. It just means that it's something that was not your normal way of functioning. And you may not have the tools to deal with that new change, like that you said, marriage, because you get married or you have a new child. And Julia, I would like you to allude to, what are some of those adjustment pieces? When do you know, even if you have a new kid, a new baby, that, it's time to make some adjustments? It's usually when your coping strategies are overwhelmed and they're no longer effective in dealing with the stressors you have. What you usually do to bounce back and get out of a spot or a stressor is usually if that is overwhelmed, then you're like, you know what? I need to do something about this. I need to talk to somebody about this. And sometimes your support system is not sufficient to do that. I have this saying I like, that don't make your friends your therapist and don't make your therapist your friend. Know the difference between those so that you're not overwhelming your friends with what you should be talking to a professional about, and don't try and also overstep the boundaries with your therapist to make them your friends as well. I see one of our colleagues, Maga, has her hand raised. Maga, did you want to say something?
Just real quick.
Go ahead.
Okay. So I just wanted to say real quick hello to everyone. But I wanted to mention that one of the key things we forget is that mental health is just as important as physical health, and they coincide with each other. It's not a separate, it's not a separate part of your body. It's really inclusive. And so when you're looking at what is my deciding factor as to whether I need to get mental health or not, is looking at the tiers, is that it's a basic life function. If it's your basic life function is being affected, so the necessities of sleep and food, and those are all elements that are really important. So if that is being affected in any way, it's just time to check in. And there's nothing wrong with just getting an assessment, or, going and getting an assessment done, because the same way that with your health, you go to your doctor, if that's not working and that's your friend, it's not working. The same way you'd be talking to a friend. And if that's not working, then you go to the next tier, which is urgent care, right? And then you try as much as you can to work it through the urgent care rather than end up in emergency care. So that's how I kind of look at mental health, is that if your friend is not enough, then it's time to go to a therapist, because the worst thing that we would want for any of you is to end up in a psychiatric 5150 hold. And that's not what we want. What we want to do is kind of handle it in the tier of that urgent care, which is being able to kind of take care of that and being able to work with you alongside. So that would just be my input as far as looking at how do I assess, look at your emotional thermometer, the same way you look at your physical thermometer. Hey, I'm feeling hot, I'm feeling this and that. Assess is am I more irritable than usual over 2 weeks? Am I really just in a constant state, as Lillian had mentioned? And that should kind of give you an idea. Like the way we look at kids is that when I tell kids is that when you're looking at your emotional thermometer, is it good, bad, and really like to the top? And I have different pictures, but that's something to kind of look at also as adults too, is your emotional thermometer to gauge.
Oh, what a nice way of putting it. I like that. Always looking at just the holistic piece of yourself and thinking about what's the gauge. I like just how you've put that. And I'm curious to you and also our fellow therapists on here. So some of us have gotten over the hump of, okay, I'm gonna seek help. I'm gonna go. I called, I schedule an appointment, and we'll come back to the idea of how to identify a good therapist. But let's jump ahead and think about, so I have that first appointment scheduled for 2 weeks from today. What should I do? How should I prepare for that session? What do I bring to my first therapy appointment? How do I get myself there? Because when I'm going to see my medical doctor, I kind of know what to do. I know what will happen. So Julia, what's that first session like? That first meeting?
Yeah, and we usually say the hardest part when you're trying to find therapy is the courage to actually pick up the phone or send that email. So we just want to validate you. You've already been there, you've made that phone call. So within maybe that week or 2 week period, depending on when your session is, or maybe the next day, because you made a booking for an emergency, is to remind yourself about either your history, exactly what you're feeling. What do you want to talk about with the therapist? Because it's important for you to know that the session is about you. It's not about the therapist. Because sometimes we have the nerves, we're wondering, I want to come out okay to them. Or you want to gloss over what you're really experiencing, what you're really feeling. No, we want to know exactly what you're looking for, what kind of help you're looking for. So being honest about it, what you're feeling. Therapists are trained to be able to differentiate and help you work through and figure out what the goals are. And that might not necessarily be the first session, but the first session is really about you. So please don't worry about trying to impress the therapist, because that's what we go through, especially women. When you're going to the doctor, you're like, I have to have all these things looking good because I want to impress the doctor, but they already know you're not feeling well. So it's the same thing with the therapist. It is about you. You matter. And then my friend Ruth asked a really important question. How do you get to know the family history? Because that's one of the things that therapists, we ask you during your intake session. We give you some paperwork to fill, and one of them might be about your history. And so sometimes you're nervous because maybe our families, most of us, when you're from another culture, the family might not have talked about mental health history. So it's good to jog your memory of what you remember. For example, if there was depression that you now as an adult realized that was my family member experiencing depression, or the family always talked about, I know in Africa and especially in Kenya, or my language, my tribe, we used to have a saying where somebody was born a little, I don't know the word to use, but they say a little funny or whatever, meaning maybe they had experienced growth issues, or they had experienced mental issues when they were a baby. So those are things to remember. And if you don't know them, the best person to ask is if you have living parents, or if your aunties and uncles are still alive, the one that you relate to the most, they'll be honest with you. And also checking in with your cousins. There's always a cousin with more information than everybody else, because that's how families work. There's always somebody who knows the family secrets more than you do. So, and if you have a family group, like a lot of us have family groups now, like on WhatsApp, it's okay to ask that question and say, you know, I'm trying to put a history to see how we can get some help. Just reach out to me privately, but this is what I'm wondering. So you're starting to have that information ready. You're preparing your heart in knowing that you need to be honest, completely honest with the therapist, because it is about you. And then there are no wrong or right answers in the session. So whatever you say, we've been trained to sit and listen to you. We might ask probing questions to try and get you where you want to go. But while you're sitting there, I will let you know that our training is not about judging you. It's about hearing your heart out and trying to see how we can best help you, or at least at that particular first session, listening to your needs so that we can come back and work with you on your goals and what it is that you want to achieve in the session.
Oh, thank you for that. Brenda, you want to add something?
So I just want to echo what Marga and Julia talked about. I come from a preventative health perspective. One of the things that sometimes I'm noticing, especially now with COVID, is that most of the clients we are getting at work are being referred by doctors. And when we ask them what has been happening, there's nothing medically that the doctor is finding as a problem. It has, and the doctors are saying it's more of a psychological issues. So I'm just giving that example because sometimes things show up as Marga was saying, as a physical issue, and it might be a psychological thing. So if something sometimes is going on with your body, I'm not saying don't go to a doctor, that might be a sign something is wrong. I know for myself, if I really get that stressed, I always start feeling pain in my neck. And that is a sure sign that, okay, Brenda, you need to take care of this. Research has shown that 90% of physical problems have psychological roots. And I want you to think about that, that if 90% of our physical problems have psychological roots, that tells me something, that I need to maintain my mental health. It's funny that Lillian, you just asked this question. We all struggle to access a therapist. Actually, last night I had to get myself and book an appointment with a new therapist. I sat here, it was midnight, I'm like, I gotta do this, but I had it done. So what am I prepping myself with? Some of the things I've struggled, and I know we're human beings, we sometimes forget, as Julia has said, just write things down. It doesn't have to be in a very conk language, just write it in your simple terms. Like I know one of the things I'm struggling with is I'm going round in circles about a certain thing, and I'm like, okay, there's something that's going on here. I know a few years ago, I had to start a certain project. It was not an issue of money. It was not an issue about knowledge. It was not an issue about support. And I just kept going round in circles. I'm like, okay, something is going on. What is it? And I knew one of the things that I needed to is sit down with a therapist and figure out what is going on here. What is this? They call it self-sabotaging behaviors. What am I doing to myself? And I'm going to tell you, after I sat with the therapist for 3 sessions, I started the project. So what am I saying? Sometimes we seek therapists for different things. It might be something like a career. It might be something as a project. That's what I'm just thinking about. There's so many things, and just do it. Okay.
I like that. You echoed the idea that most of our medical issues can be attributed to some mental health issue, psychological issue. And I remember a research paper I wrote, I think this was as, I think I was an undergrad, that the majority of those of us from collectivist cultures, which is most of us people of color, whether we are of African descent, Latinx, whether Asian or people of color or indigenous folks, we tend to have psychosomatic complaints, and that is we attribute everything to it boils down to a medical issue, because most of the time we don't have the psychological language to label what we are feeling. And sometimes we say my heart is dropping, or we have all this language we use to describe a mental health issue that's not in our diagnostic manual. And so it can be very frustrating, and we will first go to a medical provider. And that's why most of the referrals to therapists for people of color tend to come from a medical provider, because we are safer going to a medical doctor and saying, this is going on because you're thinking it's a medical issue. But sometimes having the intuition or being very intuitive about self-awareness, I think, Brenda, when I talk about just being aware of, this is my baseline, this is my normal, and this is where something is a little bit off. And yes, you may say it's psychosomatic, and most therapists, especially therapists of color, are trained to be aware when a person of color is sitting in front of them and they're using language that doesn't fit the traditional Western approach of diagnosing or looking at a mental health issue. Somebody will help you to be like, oh, we have a checklist sometimes to say, is this going on? Is this going on? Is this going on? And it may help you arrive at that place of saying, oh, this thing that I'm thinking is somatic is actually psychological. My sleep issues are not just because I'm tired, and me being tired is not because I work long hours. Because especially if you wake up, I know I've been there where I wake up and I'm tired. And it's so easy to say I'm tired because, and try to rationalize why, or attribute that to something medical or something external. And sometimes it really is something that's deeper than that. But as people of color, we tend to be psychosomatic in how we are describing our symptoms, and that is okay. It's the language, it's the cultural impact of how we present, but being mindful that sometimes it's not, you can't medicate it away, especially if it's not psychotropic medications, and just being mindful that don't be scared. And going back to the question I was asking earlier is, people have asked me, so when I go to that first appointment, are they going to ask me about my childhood? Are they going to ask me about my grandmother? Are they going to ask me about whether I've been, it's a whole list of questions we usually ask. And a lot of times we minimize as a client, we minimize because, like Julia said earlier, we want to impress the therapist. And then my question is always, so if you're doing that well, why are you here? And people say, well, I'm doing good. And I'm like, no, actually, this is where you need to kind of bear yourself and say what's going on. And sometimes we don't want to throw a family member under the bus or a friend and say they're having a negative impact on how you're doing life, or you think I'm a failure if I don't like my new wonderful job or whatever it may be. But it's really important to be able to present yourself genuinely. And the more authentic and genuine you are in that first session, the quicker it is for you and the therapist to figure out, where do we go from here? And so being very honest about, hey, this is exactly what's going on. It can be shameful. Most of my clients that I see after the first session, there's a sense of embarrassment of, I talked to this stranger and I told them all my issues and I feel naked. I've had a client say, I felt so naked and embarrassed to come back to the second appointment because I told you all my stuff. And those of you who are therapists here, you hear them saying, I've never told anybody this. And a good therapist will validate you. They will give you the space. Most therapists, especially a good therapist, is not going to shame you, is not going to judge you, because that's why you're there, so they can help you. So it's a really important piece to, how we all floss before we go to the dentist.
Yeah.
Or girls, we know how we take care of ourselves down there before we go to the gyno. And somebody put a joke the other day, and you fold your underwear and everything nicely and your jeans, and you put it in a nice pile away, and then you're up on the stirrups. They're like, they don't care. They want to see everything because that's the best way they can help you. And that's the same thing with therapists. The more open you are, I don't think for those of us who are therapists, there's nothing you'll tell us and we'll go like, oh my God, did you just say that? We actually open up and say, okay, give it to me. This is your space to share that. Julia, you wanted to add something to that?
Yeah, because as you were speaking, I remembered one of the tough things that we have, especially when it's a couple coming in for counseling for the first time. Usually, it's very rare that both spouses agree to come into the session. Usually, the husband might be a little reluctant to come and talk to a stranger about the issues in the marriage or the issues in the relationship if they're dating or if they're engaged. And so if that is the case, that you want to seek relationship counseling or marriage therapy, and you're concerned about your partner not being completely on board, therapists are aware of that. Therapists, psychologists, psychiatrists, advocates, and sometimes even pastoral counselors who are trained in therapy, we are aware of that, and we have a way of speaking to you as a couple while respecting your spouse, because that's the important thing. There's always concern, especially in my over decade of working with couples and people, is noticing the men wondering if they're going to be ganged up on in the first session. So if they come in with an issue, that's what they're concerned about. Who's going to gang up on me? So they always come with their complete shield on. And for most of us, I have worked with people from every single profession I could think about and background. And so they come in with the full armor. Most of the time when I've worked, for example, with law enforcement, they don't really come in with their weapons in the session, but you know that they're really aware. They're still having that mentality of being vigilant. So our goal as therapists, to let you know as the people on the other side, is to completely start you as a couple at ease and not to attack whichever spouse was reluctant to come in. Because we ask you questions that help you open up. So we're not at the beginning trying to blame somebody about what the issue is. If you come in or bring in children in family therapy, you have a teenager or a child who is reluctant to have come in because of whatever issues they were dealing with. Maybe they were cutting, maybe they were depressed. I've had parents who've come in with their children to see me because the children expressed desires to kill themselves, especially during COVID. And so we're able to comfortably talk with a child or with a teenager and be able to express to them that this was not about us and their parents ganging up against them. So if you're that parent who wants to take in your child or your teenager and just you're concerned about that first session, how it will go, I really want to reassure you that the questions that we ask, and if you find a good therapist, the questions that they ask are geared towards comfort and letting them first realize and be comfortable in that particular session before they open up on what the issue is that they need. So we're aware of that, and we have worked with people where the couple, one person is willing, the other person is not willing. And we have the methods and ways to be able to work with you even in such situations.
That is so useful. And I just want to let everybody know that sometime soon, possibly next month, we're going to do some work around relationships and couples work. And that is Julia's really one of her primary areas. And we may touch back on how to navigate couples work and how to navigate relationship issues and get support and help from a therapist. And so you brought up an issue that I want to put out there again in terms of what are some things that a therapist, because I always say your therapist is like your priest. You know, you can say anything in there, you know, you can confide, and it's almost, or a lawyer where, you know, everything you say stays in there, you know, it's legally bound. But what are some things that, or how does confidentiality work? Maybe let me put that out there. How does confidentiality in therapy work? Because some people I've had some informal conversations with people saying, I'm reluctant to take my kid to therapy, especially as an African parent, because they're going to say things that may have legal implications for me, especially for those of you out here in the US or in the Western world where you're kind of worried about what's confidential, what is not, for you as an adult, and also if you send a kid to therapy?
I'll answer this one because of dealing with families in therapy. So when we have you sign the paperwork, especially in the state of Florida, we explain what the confidentiality covers and does not cover. So everything we discuss with you as therapists is confidential, except if we suspect that you are thinking of hurting yourself or hurting somebody else. So if you come in and say that you're thinking of either you have actual plans to hurt yourself or plans to hurt somebody else, homicide, suicide, any of that, if we suspect that you are involved in child abuse or elder abuse, in Florida, it's a big state about older population, seniors. So we have a very, very strong laws on elder abuse as well. And then if the court subpoenas records, for whatever reason, sometimes couples are suing each other in divorce and they're trying to subpoena records. So we'll talk to you about that. But what we have as a disclaimer is in all those situations, we let you know beforehand. Before you sign in for the session, we let you know that in these situations, like with my clients, I let them know these are the areas that I can't just keep to myself, because my goal is to help you, is to save your life, is to save somebody else's life, is to make sure there's no child abuse going on, is to make sure there's no elder abuse going on. And in those situations, we're finding help for you. And I also walk them through, if the court does subpoena records, this is the process that works through. So we demystify it for you. The other thing to realize is that in this issue of confidentiality, it also matters on what therapist you go to about the issues, because there's some issues that happen that are cultural issues that are not necessarily mental health issues. And a lot of therapists have started to realize that, like if somebody comes in the session and the child says, oh, mommy slapped my hand because I reached up on the stove and and they're like, and I hate her because it's a kind of a culture here where the kids will be like, I hate you or whatever it is. And so we listen, we don't just jump immediately and assume that means that the mother or the father is abusing the child. And if there's suspicion of that, they actually speak to the child and kind of hear where the child is coming from. So it's not just immediately we're going to be like, oh, this is an abuse situation. Or they're like, mommy spanked my bottom because I was running across the road and there was a car. So we don't just go like, okay, now we have to report that immediately. But if we understand that there was a physical altercation in the couple, for example, if you're having domestic violence, and the dad or the mom in America and in Florida, either spouse can be arrested for domestic abuse. They don't just arrest a man or they don't just arrest a woman. It's whoever initiated it. So if that happens in front of the children, then we have to talk about it, because that is one of the issues that we are required to report as neglect or abuse or whatever. But usually we will talk with you, we will listen to the context of what's happening to be able to find you help. So we don't just jump into, we're going to connect, we're going to report this.
Mm-hmm. Oh, thanks for sharing that. Brenda, did you want to add anything? Or Maga, I know you have your video on. Did you want to say something?
I think the only thing I would like to add, Julia has covered everything. I don't even want to repeat anything she said. She has, because most places and locations in North America follow the same rules. I think the one main concerns I see here within the diaspora is immigrants having a lot of issues with papers. I mean, I know most of you know what I am talking about, or things like sexual trauma, or things like having a disease, like either something, maybe it's an STD or HIV. You feel like you can't tell the therapist. A therapist will not go reporting your immigration status. That's not their job. That's not their role. So feel very comfortable because it's very vital for your own mental health. And I want you to look at a situation, maybe let's say, for example, you don't have papers and something is going on. That is an added stressor in your life. And if somebody who's helping you does not understand that, they might be giving you resources that you can't even access thinking you have papers. But if they understand that, oh, this person cannot even access this support because of their papers issue, they are able to navigate the system differently. So it's very, very important, as Julia said, their limitations are those, as far as I'm concerned, those are most of the limitations everywhere. But in terms of like maybe papers, please feel free to talk to your therapist about it.
Mm-hmm. Mm-hmm. Oh, thank you. Go ahead.
I was only going to say, just because of working with kids individually, it's just really important to recognize that a lot of parents have, you know, some hesitance and also some fear-based and also some parental, like, you know, hypervigilant. And so the part of it that I just make sure I tell kids, because I've worked with kids 6 to 12, is I let them know I have to do a disclaimer, and I let them know that if there's someone that, you know, has harmed them, and I explain it, you know, at the level of their age, appropriateness, or someone that, you know, they've harmed or thinking about harming. Those are important. And so those are the aspects as far as with children, is making sure to also explain what does that look like. And I ask them, is there any questions that, you know, make sure that there's an understanding, so that they also know that that's when I have to tell another adult, because it's also in the context of the child, is letting them know, what does that look like? I have to break my thing and tell an adult, because it's about safety. If there's any issues with safety, it's important for me to make sure to do what I'm supposed to. And so that's where I kind of indicate. And so when it comes to asking about, when Brando was talking about immigration, it's so important to make sure you ask the therapist, do you have experience working with different populations within regarding immigrants of different populations? Because then that helps you know, are they familiar? And also about working with different cultures. What type of cultures have you worked with? You can ask that questions, because the important is it's about you. This is not a, you know, this is not a, when I used to, you know, be around more colleagues, I would say this is not a competition. This is really about making sure that it's not about you liking me or whoever. It's really about your own well-being. If you find that, you know, working with me is what works for you, that's okay. If working with somebody else, because at the end, I just want you to be well. And that's what's important. It's not about appeasing per se, I shouldn't say competition, but really appeasing me. But if you feel comfortable, then that's where it's important to be able to just have that conversation. But I really do highlight that it's important for you to ask those questions if that's important to you, or if that's something that's come to mind, because just assuming may find yourself in a way that now you're having to go to another therapist. So better to kind of write down your questions, see what's important for you before you, when you're seeking out a therapist, and ask those questions. And also, is it important for you to have a male or female? Find that out too. I mean, because sometimes names can also be kind of, you know, misleading, because you might end up with somebody whose name is this, and you're looking on the online, and it might be a woman, might be a man. You know, find out what your comfort level is, and that's important too. And do they also, you know, have X, Y, and Z in some of the areas that you're concerned with as far as that goes? Because we don't want to, I don't want to place barriers or parameters to where you can't be able to explore and ask these questions like you're going to be reprimanded. No, you're asking a question. They're not going to go then check your, you know, immigration status. You just want to know for your own, you know, your own well-being. So FYI.
I like that. You know, therapy, finding a therapy is like dating, because it has to be a good fit. I tell my clients, I even tell students, especially since those are the ones I work with a lot, that it has to be a good fit, because a therapeutic relationship, it's a real relationship. It's actually a little bit different from having a relationship with a medical doctor, even though I really value that relationship as well. But the difference is, with a therapist, you're really bearing everything about your life. It's not just about your medical health. You're saying, you know, you put your values on the table, you put the things that are important to you on the table. And so I'm always saying it's a good fit. It's like going on a date and you don't like the values of your date, then you decide, we're not going to continue with this relationship because Obviously, we're not on the same page. And these days, it's really important also to know what are, there are ways to figure out some of the affiliations your therapist has. Some questions you can ask directly, like Maga has talked about, and Brenda and Julia have talked about, asking questions really directly. They will not be offended because, one, you're paying for this service and you want to benefit from it. Can you imagine being stuck in a relationship with somebody that you don't like? And you're trying to be vulnerable, because therapy is a very vulnerable experience. You let your guard down and you let this person in. So imagine if this is somebody who has really lack of appreciation of diversity and difference, and wants all the immigrants to go back to their countries. Then you come in there and you talk about immigration status. It's a risk you're taking. So you want to be able to ask very direct questions. And even for me, when people come and work with me, I actually tell my clients the first time around, if this is not a good fit for you, if there's something about me that you feel is not a good fit for you, I will find you another therapist, or we can find you another connection. So don't be afraid to end a therapeutic relationship that you feel like is not working for you. Like you go that first session, you're like, because even with a medical doctor, I think first time when I moved back to the Northeast, and my family has a physician they like, and multiple of them go to the same person. And I went for the first session and that was not a good fit for me. There's a way that person was asking me questions. I felt rushed. I just felt like I didn't have the space. And they were like, oh, we recommend this person. But this person already had an established relationship with them and they felt like this was working for them. After my first visit, I told them, well, that works for you. Doesn't work for me. And I went and I found a new doctor that worked for me. Same thing with therapy. Even if I recommend somebody, and I have recommended some people to our community in the diaspora, and they went and they said, I kind of felt like this. I'm like, don't be apologetic. Let's find you somebody else. If it doesn't fit, move on to the next person. If there are people who have values that conflict with yours and you feel like maybe you're feeling judged by that therapist, move on, find somebody else. It's not always a good fit. And even though we encourage most therapists, especially if you're in the business of training people, to be culturally aware and to have cultural humility and awareness of diversity and accept it, they're not all like that. There are therapists who will want to tell you what you should do or how you should do it, and that's not really how therapy works. Esther, I saw your video come on. I wasn't sure if you wanted to say something. Esther is one of our therapists. She's a trauma expert.
Yes, and thank you so much for giving me this moment. I wanted to touch a little bit about confidentiality, and hope you guys can hear me.
Yeah.
But I wanted to tackle it in a different perspective, like where I come from or the kind of work that I do. I work in a multidisciplinary team. And so what that means is it's not just one provider that you see when you come to our services, you're seeing different providers. So we call ourselves like clinician team. So I'll be your therapist, but then you'll be working with like a targeted case manager or the social worker. You'll be working with a registered nurse. Then you also be working with a psychologist, all other people that are there, because also we also do like pain management. And so what I do when I'm talking about confidentiality, when I talk with our clients, is I'll mention about the confidentiality is we can share as a team. So if you bring any information about what is going on with you, and that is not my expertise, I'll share with the other person so that they can know what it is that came up into my session. So they already know that we talk between the team about issues that are coming in that are not supposed to be done in therapy. It's something like a social work needs that was discussed in my session and needs to go to the to the social worker. Or also too, if they bring up something about like nightmares, like the current nightmares, and they're seeing like a psychiatrist, and I know that probably they need tweaking of the medication, then I'll tell them, I'll pass that information to the psychiatrist so that they can get better care. The other thing that I was going to mention in confidentiality also is it related into like, because I do supervision. I want people that are seeing clients that I supervise to be able to communicate about informed consent. In terms of like, if you need to tell your clients that the information that they are giving to you is not necessarily for both of you. It could be discussed with me when you come to supervision, so that the clients are aware that it's not just the person that they are working with, but this information could be discussed to better your care with the supervisor that is supervising them. So those are some other issues that we need to be able to talk to our clients so they are clear. So they don't come up and say, but you told me I'm working with you, this information don't go to somebody else. So they need to sign that informed consent of like, anything that you share with me here, I'm not able to deal with this. I'm gonna share this with my supervisor for consult, but it's to better care or to better provide services for you so that we can be able to help support you. And then also too, like mandated reporting, that is also something else that we say that if something comes up, it doesn't have to necessarily come from me. It could come from other providers that you're seeing. But if you mention something that is related to either like you're wanting to harm yourself or you wanted to harm somebody else, or even there is elder abuse or abuse for the minor, that has to be reported to the officials or whatever that need, or the department that need to be taking care of that, whether it's child protective services, and it doesn't have to come necessarily from me because anybody in the team is a mandated reporter. So I wanted to add that piece so that all our clients can know that all this that we are doing is to better their services. But if we are working as a group of or team of clinicians, that information could be shared by all those people, but it's just to better their care.
Oh, thank you for that. Julia, you wanted to say something?
Yeah, actually, thank you so much, Esther, for sharing that. I think a question that you would probably be really well versed to answer is what Brenda brought up. And also Dr. Leal talked out a little bit, helping the population from the diaspora that you work with that comes in with all these multiple different statuses, and they're concerned about it because that's your that's your area of expertise, working with refugees. Maybe could you touch on that a little bit, on what the first session issues they might be concerned with, and how your team deals with it?
Yes, all the clients that we see in my office, they're all asylum seekers. So they either are on affirmative process, that means they came with a visitor's visa and they're seeking asylum here, or they are in defensive process. So what that means is they came through the southern border, and because they came through the southern border, they were either confronted by the ICE, and for that reason, they either came into this country with the fact that they're trying to infringe into United States. And so those processes looks very different. So if you come through the southern border, the defensive process means that you have to go through hearing. Versus if you came with a visitor's visa and now you're seeking asylum, that means you'll be scheduled for the interview. And there are several processes, but usually what I would say is like when they come into seeking our services, first of all, what we have to like acknowledge to them is the fact that we could be trusted people. A lot of times these people are learning from countries where they felt that they were threatened, they felt that they were being tortured, they were in danger. And so the first thing that we do is to assure them the trust that they can find safety. So usually our initial sessions are about safety and stabilization. How can we ensure the safety that they need? Safety in terms of like, do they feel safe where they are? They are hosted maybe by family members. Some of them are hosted by friends. Some of them are hosted by the community. Some of them are hosted by different organizations that we have, especially in the Twin Cities, that host people that are asylum seekers. But the whole idea of like the work that we do is all related to like the collaboration with all these people that are involved. That if I'm going to be speaking with your host family, which mostly could be about scheduling, period. maybe I don't need the host family to know anything else apart from I could call and maybe the host family is the one answering the phone call. And because then a third person have been involved, I need an informed consent or an LOI with the client to say this is just for scheduling purposes only. We make sure that our clients know that when they are signing the release of information, is they are letting us to have consent to get the documentation, whatever those documentation are. So we sign LOIs with their attorneys because those are people that we work really closely with. As a psychotherapist at where I work, usually my clients, when they're scheduled for the interview, I write asylum documentation, which involves like their history of their torture, the work that we have been doing together, the research that supports how they are presenting and how they are going possibly to present themselves when the judge or when they're doing the interview, or when they're going through the hearing. So I write that up as a professional, but also supporting in terms of like, if anything comes up that is really looking this way, is because of whatever this has happened to them. So there is collaboration between me and the attorneys because of those purposes. But also there is so much that goes with the asylum process. So sometimes we have to be used as the advocates, putting in mind that a lot of our clients don't speak the language. And so we possibly could be the best person to be in between there, communicating with the attorneys. We also communicate with the doctor. A lot of times we, like we said here earlier, a lot of our clients, they will go to the doctors for somatic symptoms. And that's how they want to acknowledge mental health is, I'm having pain on my shoulder. I'm having pain on my neck. I'm having pain this other place. And so when they go there, and then they'll come and say, I've been going to the doctor for the last 6 months and the doctor haven't seen anything. And they say that the best place to be is here. So you validate and you acknowledge the fact that is happening, but also you start teaching. I usually start teaching them about what happens to your body when you go through trauma, and what happens to your brain when you go through trauma. And so it's a lot of like building of trust, because these people, their trust has been broken. And the best way for us to provide services is to building that trust. And so, because I know this will be something that we'll probably have to talk more in another maybe seminar, I would like to chip in more about building the trust, and also too, like helping people into finding who they are now, like the lost identity, and going through the ambiguous losses, which sometimes can be terrifying and scary for a lot of people moving forward. So yeah.
Wow, Esther, we have to come back to that. We have to come back to doing some trauma-informed work and just talk about what that looks like. And you're touching on some really important things, and you're right, we need to probably set aside time to just talk about that. And you started alluding to the idea of trust, and that's when I started talking about how a therapeutic relationship, it's a real relationship. It's not just a transaction, but there has to be trust for you to be vulnerable and to be open. And I wanted to throw out there to all of you therapists, what is the much more basic question? What's the week by week process of therapy? Because I've had some people get really anxious when they come to that. The first session, the intake, whether it's a consult or an intake, it's much more of a psychosocial interview, because I'm asking, tell me about yourself, tell me about your family. Like Ruth was asking earlier, tell me your family history of mental health, tell me about your relationships, tell me about your work life. That session is not so bad because I'm just asking for information, so I can have a disposition and have an idea of what's going on and give back feedback to the clients and tell them, based on what you've told me, this is what I think is going on. So after that, I've had especially African clients get really anxious of, okay, so I'm done. I've told you everything. So what, I need to come back here every week or every other week? What are we going to talk about? Because I've told you everything. So I'm curious if you all can share about, because all of us here who are therapists, you've had clients come for however many sessions, whether you do short-term work or long-term work. What is the week-to-week experience like I mean, Julia, when people come to you for 4 months, what are you all talking about every week for an hour?
Yeah, that's a really good question. And also, it goes towards the therapist training, the particular model that they're using in therapy. If you've had the question where people tell you to go and ask the therapist what their style of therapy is, it's helpful and not helpful because it depends on what issue you're dealing with. But also the way we conduct the sessions has to do with that. So every session usually is based, so the first session is the history session, finding out what you're coming in for. But the sessions after that is usually hearing where your heart is about the issue. And the therapist, we spend a lot of time listening to you and reflecting and asking questions, helpful questions or even offering suggestions depending on what it is that we know might work. But it's really, really geared towards you. And what I tell all my clients, whether they're coming in for education, because I do a lot of premarital counseling education or relationship enrichment education, it's the same thing. I tell them the first few visits sometimes are painful because it's like when you visit the doctor and you had a Band-Aid on your wound, the doctor has to take it out and clean the wound before they put medication and bandage it again the proper way. So when we talk about the history of what you've gone through, it's going to hurt because you're remembering. So I walk them through, this is what's going to happen during the week before I see you again. You might have the feelings of regret. You might be feeling really raw because you just talked about things maybe you haven't thought about in a long time. So I walk them through how to deal with that trigger. And usually I do that probably in the second session because I want them not to feel a sense of shock when they start experiencing a lot of pain based on the issue they came for. So that way, it's the way a doctor would be telling you, this is going to be sore for a while and this is why. So that's what we walk our clients through. We tell them, it might bring up emotional pain for you that you haven't dealt with in a while. And this is what to do before I see you the next time. And then you can reach me. In my case, I usually have my clients reach me anyway in between sessions if they have an emergency. So it does depend on how your therapist works and what their mode is. So that's what I wanted to point out. And I also actually want to, I see that we have some therapists in Kenya to hear maybe what the difference is on the ground when you're doing it in Africa. What are the differences that you do with clients so that people coming in know also what to expect from you? Thanks, Dr. Leo, for the question.
Absolutely. Any other thoughts about what the initial therapy session looks like, or the week by week? Because I know it depends on, again, the modality that you're using. Maga, you want to say something?
Because I have a younger population, it's mostly play. We do quite a bit of different games. That's how I notice that, children really open up, is really coming down to their level of what brings, more of a rapport, building of trust. The way Esther was talking about is really play. So each week is different, and I have different activities based on whatever it is that I see that is happening that I'm also teaching, whether it's social skills, whether it has to deal with a child with autism. We're going to work on social skills, things that identify that we're going to do that. Each week is going to be different. Whether it's a child who's, maybe just has some indicators or some issues that have come up at home. There's that. There's also children with ADHD. There's some of that where I work on the attention. Let me see how long I can keep your attention. So I do different games in order to kind of capture that and bring that awareness, because sometimes we don't even recognize that. So I have different tactics, different interventions per se, and being able to kind of gauge and see and being able to have that discussion. So it is a little bit easier. It's a lot more fun because of the play. I mean, you have so many different types, but when I've had to deal with adults, it's a little bit different. I like storytelling. At times it's kind of it's starting where they want to. Sometimes it's just kind of really, it might not even start that way. where do you want to begin? And other times it's, if in the time that I did practicum with couples, it was, I loved the story of how did you come together? That's always been such a best way, and kind of building off of that on their different versions and hearing that, because that also kind of brings an awareness for the other, that's perspective, perspective. But each week is different because I start off where it's at. You have a couple who started off with the fight, who knows, we're working on something they didn't get to, we're getting this. Something came up with an adult, if I was doing an individual. So it all really depends. I start where they're at because every week is different and there's something different that happens.
Thank you for sharing that. And it really varies when you're working. You said, like you mentioned, with kids. I think I remember one of my rotations working with kids. I had a lot of fun. But they really tug at your heart because termination with children is so painful, especially if they want to keep going and maybe their coverage is up or they're moving away. And so I knew during my rotation that I enjoyed it, but I would be so heartbroken when would be terminating. So I primarily work with adults. But I want to echo the importance of having goals. Again, we alluded earlier to when you're looking for a therapist that you interview them, you want to know how they work and, set some expectations there. And sometimes people come to therapy and they've Googled a lot of things about therapy that may not be accurate. I had a kid send us an email. I say a kid because they are incoming freshmen, email us this week and they said, I want a CBT therapist. This kid has no idea what CBT means, but somebody somewhere told them, or Dr. Google told them that you need to find a CBT therapist and they don't understand. So don't get caught up in, are they psychodynamic? Are they CBT? Are they interpersonal? Are they, and if you're interviewing them, ask them to break it down into lay language. Like, what does that mean? I've had people come who say, I really am a hands-on person. I will only see change if you give me homework, things to work on in the interim until the next time we meet. Give me a worksheet, give me a journal I have to enter stuff in. Then I have the ones who say, I'm a very reflective person. I need you to give me stuff to reflect on, activities I need to just engage in. I don't need to write anything. And for most of us therapists here, you're probably a lot more eclectic, like you can do integrative work. So sometimes asking specifically or your style of making changes, sometimes it's helpful rather than getting caught up in the jargon. But on the week to week, it really is important. Therapy is expensive. I think we can all agree it costs a pretty penny to pay for therapy. So it's really important for you to maximize therapy if you're going to do this. And so you want to be very proactive and advocate for yourself when you go to therapy. So you're not, because there are therapists who are very passive, and especially the more traditional psychoanalytic therapists may be very hands-off because they're following your lead. And if you go in and you just are non-specific, you leave there after 50 minutes and you're like, what just happened there, But if you want to be very goal-oriented and very hands-on, so you get your money's worth, you want the week to week to have some tangible results. Ask questions. What do I do this week? Am I doing better? Am I feeling better? But you have to be, I always tell my clients, this is a collaborative effort. It's very different. I tell the college students, it's very different from guidance and advising in high school. I'm not going to tell you what to do. We're going to work together as a team, and it's collaborative because as you all know, when you're told what to do, once you're done doing what you're told, then you stop, then you wait for further instructions. But if they're collaborative, I tell them, you think about what would work best for you and bounce it off of me. So every week for me, we talk about why are we going this route instead of the other route? Or think about how you got to where you got to. So I'm more reflective in that regard of saying, how did you get to that place where you were so we don't get down that route? How can we build new coping strategies? And so for me, every week, I'm like, where are we? And I challenge my clients to check in every week, because if they plateau and they're not making any progress, ethically for us therapists, we just can't continue working with you. And because we're getting paid to say, just keep coming, but you're not getting anything out of it. I'm always quick to say, I don't feel like we're making progress, and let's think about what's going on there. Because again, it's unethical for us to just be taking your money and you're not recovering. And if there's resistance in terms of somebody who we tell you, go do this, and then you do the other, or you do nothing. And most seasoned therapists can tell if you're trying to do the homework 10 minutes before you come to session, we can see right through it. I know I usually can. And I'm like, so when did you do this worksheet? They're like, when I was in the waiting room. Then I'm like, are you doing it for me, or are you doing it for you? You know, do you just want to be evaluated by me, or do you want to make some life changes? So I challenge them. I'm very direct in my approach. Even with the African clients, I just tell them, you know, what do you want to get out of this? And then after a few sessions, we check in again and say, so how are we doing with our goals? It's really important to have a plan. And once the goals are met, if we're talking about weather and we just randomly having conversations, then I'm like, do you think we've actually reached, you have achieved your goals for therapy and we can stop? I don't want you to keep paying me if we're just coming here for small talk. So the week to week will vary, like my colleagues just mentioned, based on the style, based on the motivation of the client, based on the age of the client, based on, there's just so many different factors. There's not one way of doing it. Did anybody want to add on to that before I ask another question?
I feel like had forgotten, but this weekend I had someone approach me and ask me, you know, something so similar, and it just came to my mind, and they asked me, how come, you know, I'm not, I've been to 3 sessions, why isn't this working? And I had to really go back and have this discussion to let them know 90 to 90% is really you doing the work. I'm just that one kind of showing you, like you are as a driver, I'm kind of showing you the blind spots. So 10% is me coming in, doing my work to be able to prepare for you as to what's going to be part of, you know, the session, what that looks like. But I'm really the liaison. When you're in this car, you're the driver, you know, and I'm not talking about children, I'm talking about adults, you know, adolescents, those who are at that age of being able to just really be able to get that mindset. This was an adult. And so I told him, I said, when you're in that car, you're the one who controls the car. So all I'm doing is just kind of bringing out the blind spots, areas that you're not able to see, but all of it, 90% of it, 90 to 90%, that is you. That is you doing the work. So if you want progress, you want to be able to see changes, I let him know that you have to do the work and it has to be coming from you, because you yourself are aligned enough to know what works. I can tell you, but at the end, you're going to make your decision, right? If I tell you to go left and you've decided I'm going to go straight, it's really you who ends up making the decision. So I say that as we as therapists, it's really just guiding the way and not really making sure to, you know, this is you, you know, me, you're coming to me as the hierarchy, but really you are actually the one who has an awareness of knowing what works for you. You are the storyteller. You are the one who can be able to tell, you know, is this going to work for me or not? But I hope that I can be part of your journey to help you navigate so you can get to the goal that you want to get to.
Thank you, Marga. Thank you so much. I like how you said that. I say that a lot. I'm just the GPS. You know, you're the navigator, and also it's empowering because I don't like clients depending on me, because where they say that I'm gonna do it because you said so, or they say I can't move unless you tell me, or I actually like sometimes when they miss a session, because then I want to see how did you do without seeing me. Because then you want them to walk on their own after a while. You want them to navigate without your voice in their ear. That's really important. So if you find yourself depending on your therapist too much, that, you know, when you watch, of course, movies exaggerate things, but you've seen people on vacation, but they're like, oh my God, I gotta call my therapist, I'm having a panic attack. Of course, they exaggerated in the movie, but I want my clients, if they were having a panic attack on vacation, that they would go back to the tools that they have learned, and they will say, okay, let me work on my breathing. Let me work on, Brenda posted something really good on our page the other day about grounding, that I would say, everybody go take a look at that. I tell them, ground yourself. What grounds you? What centers you? So that they don't feel like they have to call me every time they feel like they're, you know, they're falling apart. I want them to be able to do it on their own. And that's when you know that you're making progress, when you say, you know, I can stand on my own feet, I can walk on my own without my therapist, then that is progress right there, so that they don't depend on you. Julia, you had something to say.
Yeah, thank you for bringing that up, because I was thinking about another huge elephant in the room during sessions, especially when you're deciding to sign up and having your therapy session. If you're a person of faith, there's always the concern of what role does your faith play in this particular therapy session. Wondering, it could go either way. If you're wondering if your therapist respects your belief in God, or if your therapist respect your belief. Maybe you have a different faith. Maybe you're of the Muslim faith. Maybe you're agnostic. Agnostic means you're not sure either or maybe you don't believe in any God, or maybe you believe in one of our African religions. So it's important. If it's important to you, it should be important to your therapist. We want to point that out. So it's okay to bring that up, because for a lot of us of African descent around the world, it doesn't matter whether we're Black Americans, Caribbeans, Islanders, Cape Verde, whatever it is, we all have an innate, very high sense of spirituality. Not necessarily religion, but spirituality. So it's always an important part of our growth and our healing. Please bring it up to your therapist, even in the first session if you want to, or the second session, and what they believe about it. Or it's not really what the therapist believes about it, but it's about them respecting where you're coming from. And we're not saying that if you're a Christian, you should only go see a Christian therapist, or if you're a Muslim, you should only see a Muslim, or agnostic, atheist, or whatever other descriptors or intersectionalities that we have in our lives. But if religion is an important part, if your faith is an important part of who you are, then it's very necessary to bring it into your session, because it's part of your healing. It's part of how, and for a lot of us, when we ask you about your support system, because your therapist will speak to you about your support system. It almost doesn't matter what issue you come in. We will always talk to you about who is around you, and we'll talk to you about your support, who can help you go through whatever you're going through as you recover. So if faith is an important part of it, please don't be afraid to bring it up and find out if it's incorporated in the session or not, or if you need it to be incorporated in the session or not. Because as Dr. Lillian said, if they're not able to do that, then they can either find you resources, or they can refer you if all the other parts in therapy are not working. The other part is, it's possible to see a therapist who is not married for marriage issues, because that's the other thing we see in therapy as marriage couples. As somebody who works in couples therapies, I myself have been married for 21 years, but I happen to know my therapist friends who are not married are phenomenal couples therapists. So it's not necessarily whether the therapist is married that makes them a good therapist for couples. It's what your training is, it's what your experience has been in helping the couples. Pretty much, like using the example, I've never asked my doctor, have you had this condition before you treat me about this? In our age, when you're 40 in the West, and I think in Africa now, we have to go for mammograms. You have to start doing your mammograms, preventive screening and all that. Well, I've never really asked the doctor, have you had breast cancer, or have you had this, or diabetes, when they're checking our sugar levels and doing all the physicals on that. I've never really asked them, have you had that? So why would I trust your experience in telling me how to lower my blood sugar, or whatever it is that we're dealing with? So I just want to bring that out, that your therapist might not have experienced what you've experienced. They might not have been a sexual assault victim, but they are really equipped in being able to help you to deal with and cope with that. Because I've seen the prejudice that comes across usually is to do, especially in couples therapy, when you go to see a therapist who is not married or has been married and is no longer married, and they have issues with that. I want you guys to know it doesn't have anything to do with that. It all depends on our competency and practicing within the levels of our expertise and what we've been licensed to do, or in other countries, what your board or organization has allowed you to do. So I just wanted to make sure that we bring that up.
Oh, wow. Thank you, Julia, for echoing that. And I am one of those, I'd say, I have, for many years, I have taught graduate level classes in marriage and family. I have done work with so many couples, whether it's premarital work, whether it's people who are already married, been married for many years, but I am now married. And I still do the work, and my capacity to help couples has not been hindered by my marital status. So do people ask? Yes, especially another topic for another day. As people of color, people always questioning your competency. Do you know what you're doing? But I usually stand my ground and I let them know, you're the one in need. And I've hardly ever had couples who say that I'm not competent because I'm not married. I've been able to really do good work with them. And I have a question that I want to direct to Brenda. And so I'm seeing one of my good friends from, actually, we have somebody from Sweden on here. And she's asking, Chebet is asking, because you do preventive work, how do you reach mental health cases who are unwilling to visit mental health clinics? Especially since I know, Brenda, a lot of your work has been community-based, a lot of preventive work. So when people are dealing with mental health issues and they are unwilling to come to see a therapist. And I know I do a lot of outreach, but I wanted to ask you, what do you do with that? People who are like, I am not going to see a therapist.
I think it's mostly the education piece of it. It tells me that most people are, from the kind of work I've done, there's a lot of hesitancy, especially from our African community because of stigma. But once you get to educate people, the importance of it, again, your emotional and mental health is a very big aspect, an important aspect of your overall health, actually. Remember what I talked about, the 90% of physical problems have psychological roots. So I do a lot, and I've continued to do a lot of work on education and understand why. I usually try to understand the why, because you cannot solve an issue if you do not understand the why. And once you understand the why, it's usually easy to relay the information. Does that mean that people really change? No, sometimes they take time, and we end up just coaching people slow by slow and let them ask questions. And you find that people are changing, especially when they see, and I always tell people, and I'm going to challenge people here, those that have not sought therapy. For example, maybe someone here is very, very hesitant. You don't even know where to seek therapy. Go to a website like Psychology Today. There's a lot of therapists all over the world. Search the one that's closest to you. See what they offer. Just read their profile. If you like females, narrow it down to females. If you like males, whatever you want, there's Christian therapists there too. And do yourself a challenge. Take 15 minutes. Most of these sessions, the 15 minutes, 15, 20 minutes, most therapists are offering it free. Call them, just have a feel of what that call is like and what you'll talk to. I believe, just to answer the question again, there's a lot of education. Is it a one-time thing? No, it's an ongoing conversation. Again, let us find the why, then we can go from there.
Love it. You want to add some more, anybody? Julia?
Yeah, I wanted to talk about when you're not able to pay, or your insurance is not able to pay for your therapy sessions, because that's a big deal and one of the main hindrances to therapy. And I know I see we do have Miss Nesta Theuri in Nairobi right now, who's a therapist there. And we know here, at least here in the West, when you type in for free therapy resources, there are a lot of community clinics. And what I tell people is, even if you don't know where to go, where to turn to, especially in the state of Florida, if they reach out to me, I will find them either low cost or free sessions within the community they're in, because there are a lot of resources available online. There's also telehealth right now, especially with COVID. There's a lot of sessions that can be done online. So I wanted to make sure that we point that out to you. Please don't let the price or the cost of a session be the reason you continue to suffer, because right now mental health has been elevated all over the world, and it is a need that we have, that we are able to help you and point you towards free resources, community clinics, and even websites where you can find therapy at a flat rate, where you don't have to worry about negotiating with them. Because for a lot of people also, maybe you don't want your therapy sessions appearing on your insurance package. Whatever it is, we're able to point you out in a direction to help you get sessions. So don't let paying be the issue while you continue to suffer.
Well, thank you for saying that. Over the last year and a half or so that we have done this work, for those who register for the webinars, I tend to email out some resources. So when I email out the recording of this webinar today, I will attach some resources, especially it's a little bit easier for those of us in the West that you can, like Julia said, you can find a variety of places where you can get free therapy or therapy on a sliding scale. You can find therapists of color, like we have places like Therapy for Black Girls. We have, you know, Male Therapy Collective. I think we have a bunch of different resources. Taraji P. Henson has a whole list of free resources on her website, which she did in honor of her dad, that you can get a lot of resources. But I know at home, therapy is expensive back in Africa. And so, but I have a whole list of different areas that has been contributed to our kind of resource base by clinicians in Africa. And so I can share that again for people who are looking for a therapist. You are in Nairobi and you're like, you know, some of those places can be pretty costly, but we have some places. I think most of the hospitals have a wing, have a department, mental health department, where you can get some therapy, but I can send those resources as well. Our time is up, and you know, we barely got through half of our questions. So I have a feeling we may do this again some other time. I really want to encourage you to ask questions. Even those of you, there are quite a few people who are popping in and out on Facebook. I can see them coming in and out, and I get a lot more questions after we are done with the webinar. And we will probably do another session to just do a Q&A on therapy, how to go about it, how to schedule, how to maximize it. There are a few other questions I wanted to ask, but we'll save that for another session. So I'm going to give our panelists maybe a minute or two if you wanted to close with something. Did anybody want to say something before we wrap up?
I will just close out, wrap up by saying that if you need resources in Nairobi, especially in East Africa, when you type in just free therapy in Nairobi or free or low cost therapy, a couple of organizations that are non-governmental are going to come up for you. And I just wanted to point that out as we close.
Absolutely. All right. Okay, we are going to close here for today. I really want to appreciate you all for showing up, but especially Julia and Brenda and Maga for your contribution also to the webinar today. I am so grateful. Esther, and actually today we just therapy loaded on here. I can see my really, really good friends here on, and I see Nestor is saying something. Nestor, did you want to say something? Did you want to, are you in a position to unmute and say something? You're a resident therapist in Nairobi. You're still on mute, Mama.
What I wanted to say is the problem here in Kenya is the people who have the mental health issues have fear and they don't seek therapy at the appropriate time. And at this time, it's really, really worrying because there are so many killings, women hurting their husbands, boyfriends hurting the girlfriends, and also sometimes killing the whole family. You find the man has killed the wife, killed the children, and killing himself, shooting, and especially in the police force now, it has really become a very, very big issue because of at this time of the corona, there is loneliness, there is hopelessness, there is no movement, and the people are not seeing other people. So it has even worsened before the way it was. And also people have the mentality that if I go seeking therapy, I'll be called a mental case, and I don't want to be declared, recognized as a mental case. So they take a lot of time. Yeah.
Thank you for sharing that. There's such a huge need. And I know there was some really brutal killings this week. I think that was Embu with the brothers. And there's a lot of trauma and even secondary trauma. There's a lot of fear. People just sometimes just traveling from the market to back home. And we really, one reason why we do these webinars is to reach people who, like the question Chibet asked on Facebook, is people are afraid of actually taking that step to go to therapy. But when we offer these webinars, we are giving information for people to at least have some tools under their belt. And really a lot of more people want these resources, and some people actually, there's still stigma with logging in to some of these webinars because people feel like that means that I'm acknowledging the mental health. But we continue to press on, and sometimes saving one life in the village by just sharing a link to this webinar for people to know that they do have support. These webinars are free. I think some people have not logged on because I understand people thought they have to pay to be on here. These are free. They just register and log on. We do this every month, every second Saturday of the month. We are here with a different topic, with panelists, and we want to help the village. We really want to support the village because mental health, whether we acknowledge it or not, is just as valuable as all aspects of our health. And there's a lot of impact, the secondary trauma, when people are just watching their neighbors, their kids, their family members experience trauma, whether it's physical abuse, sexual abuse, murder, suicide, types of things. The impact is there, and my heart continues to just bleed for our community, whether it's people in the diaspora or back home. So let us reach out to somebody. I always challenge the providers when we meet together every end of the month that reach out to somebody and let somebody out there know that you care, you're listening, you're available. You don't have to be their therapist, but you can direct them to somebody else who can help them. People just want to be seen. This time of the pandemic, people feel very invisible. And sometimes they just want to feel seen and acknowledged, and for somebody to just see them and recognize that they are going through a season and that somebody can hold their hand through that season. And that's what we're doing here. We're working to save lives and, help people get the tools they need. We may not solve all the issues people are facing, but we can provide them with some tools to just make today better, to be able to build their resilience, to be able to live in community and have some support. So I want to appreciate all of you for calling in today. I want to wish you a wonderful rest of the weekend, and we will see you soon. And don't hesitate to reach out if you need some support. Thank you all. Have a wonderful evening.